since so many of you that are coming to this conference are healthcare leaders, I think that there's an opportunity for us to miss the forest for the trees. And I'm as guilty as anybody, but we've spent 40 years lying to our frontline workers that technology would make their life easier. Starting with what we call in the United States the epidemic, which is the electronic health record that most of us use, that we promised would make our physicians and nurses' lives easier, and in many cases just added an administrative layer. I think we are now starting the process of literally creating true technologies around predictive analytics, around automation, that actually will make all of our lives easier and decrease some of the administrative layers. So I think the challenge for us as healthcare leaders is to go through the thousands of point solutions that are out there and almost like putting together Legos, come up with a digital model that helps us improve access, quality, cost of care, and user experience. And then I think for those of you out there who are founders or entrepreneurs, I think one of the things that the last few years has taught us is you can't just have AI in your title and expect to be a billion-dollar company. You actually have to solve something and be scalable and sustainable. When I first got to General Catalyst, most of our founders were 28-year-olds with degrees from Stanford and MIT, and it was a little bit like, so why is Grandpa here? Now that literally most of these founders are finding that they have to figure out ways to be more scalable, more sustainable, more relevant, I've become like, sort of this guru around having them understand what the traditional healthcare leader will hear when they hear their pitch. So I think we're starting to morph those two worlds of digital entrepreneurs and traditional healthcare system leaders in a very positive way. I believe everybody should come to this meeting in Vienna if you are at all involved in healthcare, for a few reasons. First of all, Vienna in October is absolutely beautiful and a great city to have a conference in. But most importantly, we're going to be bringing people, both folks in the audience, panel members from all over the world that have really looked at things from a very different lens, from a lens of what's going to be obvious 10 years from now, and how can we do it today? So my guess is that so many of the different conferences you go to and other things are highlighting the problems that exist today and a little bit of the woe is us mentality. This is going to be a very optimistic conference that will be filled with global healthcare leaders, global financial leaders, entrepreneurs, founders, and others that are looking at what would the ideal health system of the future look like? What can we learn from the different countries and leaders that are here? And what can we start to do today that will start to get us closer to that goal?